Good morning, everyone. So, today we are starting with our new basic module session. So, I myself is Dr. Mithun Matthew. I am assistant professor at Dr. D.Y. Patil Institute of Pharmaceutical Sciences, Pune. I am a part of FCPI. It's my pleasure to introduce you to our esteemed guest today, our speaker, Dr. Robin George, assistant professor in the Department of Pharmacy Practice at Sri Adichandranagiri College of Pharmacy. Dr. Robin has been an academician and an accomplished researcher whose significant contributions span pharmaceutical sciences and different pharmaceutical arenas. Dr. Robin has a great research portfolio with a count of more than 39 publications with book chapters and books. His expertise is evident through the works that is through his patents and participating in national and international conferences. Dr. Robin will be taking us today throughout the complexities of research design, focusing on the descriptive, analytical, and experimental methodologies. With his wealth of experience in the academic research and clinical practice, he is uniquely equipped to help us to unravel these concepts. I welcome Dr. Robin to take the session further. Dr. Robin, over
Thank
to
you.
you.
Thank you, sir. Thank you. I wish a pleasant good morning and a happy Sunday to all the delegates who are present here. And I thank Dr. Mithun Matthew, sir, for giving a warm introduction and welcome. Thank you so much, sir. And also, I take a moment for the FCPA officials and Federation of Clinical Pharmacists of India for serving as a best platform of sharing knowledge and also giving me an opportunity for this basic module session on unraveling the research designs. So the research designs, let us today have explore a little and let's gain some key concepts regarding the research designs. So before moving on to without further delay, we move on to the title, that is unraveling the research design. So why the research design is so important? So it will be answered by what is research. Okay, so what is research? What is research? Research is like some steps. One systematically we are following some steps to find answer to a question. We call this question as a research question. Okay, so we are trying. We are executing some exact methodologies to answer a research question. That is what is a research in search of an answer. Suppose we all have studied maths. If it is a geometry, we have to apply geometrical equation. If it is a trigonometry, then trigonometrical equation. If it is that different rules, first we have to BODMAS rule. Okay, so like that BODMAS rule, first we have to go for multiplication, division. So like that, some certain, suppose if it is physics, we say some thumb rules. Okay, so like that, for each question to be answered, there should be specific methodology have to be followed to answer a question in a correct way. Okay, so that is the importance of research designs in clinical research. Okay, coming to why the research. Suppose we are all in, I guess all the delegates who here in this meeting are medical professionals. Okay, so and moreover we are all clinical pharmacists. We cannot say the dose of a drug it is approximately 650 or it is approximately 500 or it is 500 to 650. We cannot say. We and also we cannot, it may be effective or it seems to be effective. Such an answers are not possible in the medical field. We need a definite, accurate and precise values for every every cases for each and every patients for each drug there should be specific dose. So that's why see Dr. Lord Kelvin is a renowned biostatistician. What he told is, if you can measure what we are speaking about, if you can measure it in terms of numbers in a precise way, then only it is valid. Without that, one Robin is coming and speaking something blah blah blah, it will be never considered or treated. Okay, it will never be, it will definitely unsatisfactory for those who are listening. Okay, so in the area of medical science, precision and accuracy is very important. Okay, so for how we can give a correct answer, how we can give a precise answer, it is by doing research. The research will answer your research questions or a problem solution. There will be so many research is actually we are trying to solve a problem, or we are trying to answer a question. So now you see that based on what I have written, different type of questions are best answered by different type of study designs. Like every questions cannot be, suppose we may have to make a association between two variable, a drug and an ADR. Suppose one variable is a drug, the other variable is an ADR, or sometimes it may be a dose and an ADR, or sometimes it will be a lifestyle and a disease, obesity and hypertension, or it may be smoking and cancer. Okay, lung cancer. Okay, so in all these cases the questions are different, so the methodology we should use is also should be different methodology. So there is some important key concepts are there in the selection of study designs. So you can see this right hand side pyramid which says about different study designs. The basic one, we have a case series or even an expert opinion, okay, or a case series or case report or cross-sectional studies again come up. It is case control study, cohort study, and trials. The trials is absolutely randomized control trials, and all the about the pinnacle of the pyramid we can see there is systematic review or meta-analysis, which is the top-notch evidence based research. Okay, that gives the highest strong evidence is given by the systematic review and a meta-analysis. So these are all the study designs we have. Now it is our basic knowledge to choose which one for answering my research question. Hope you got the concept or the importance of research design. So this slide is speaking about exactly again why the research design and what is the importance of the design, research design. And so you can see here the components of the clinical research. They're saying ethical considerations, data analysis by biostatistical softwares, and data collection. And you can see at the blue color that is saying about research methodology. Okay, so understand choosing the research methodology is also one of the very important key factor in a research. Okay, you can see this left hand side 1, 2, 3, 4, 5, 6. The research steps we have simplified into a 6 steps. In that also you can see the first one is of course framing the research question or the objective or framing the hypothesis. Followed by we have again the second method, second step you see identify the research methodology. So for the objective we have set in the first step, we have to select now which research methodology I should follow. And please read what is there in the third step. That is rationale for selecting the particular research design. I selected this particular research design. Let it be an experimental, let it be a descriptive, or let it be an analytic, or whatever we have seen here. Let it be a cross-sectional or a case control or a cohort or a randomized control trial. Why you choose? The rationale for selecting a particular research design. These two are very important steps. So dear delegates, understand selection of the research design is very important. It's a key factor of every research. Okay, because you can see the benefits of taking a correct research design, because it helps us to answer the objectives correctly. And a correct research design will help us to complete your objectives within the time frame and also within the resource which is available. What resource, within the availability of the resources we can answer our research, and within the time frame we can answer our research, and it helps us to get the accurate, reliable and consistent result. Okay, so accurate results, or the accurate or the precise results we can get by using a correct research design. Hope you all understood what is the importance of selecting a research design. With this note, let's move on to what are the research designs and its classification. All of you, please take a moment on this. So we can see here the basic classification of the research design. So you can see the research designs are majorly classified into experimental and observational. Experimental and observational. Again, then the observational studies are divided into two. One is analytical study designs and the another is descriptive study design. Okay, then come to the study designs. Okay, so under descriptive, we have case report, case series, and under analytical, again, we have cross-sectional, case control, and cohort. Okay, so these are the descriptive and analytical study designs. So here that the middle standing one, that is the cross-sectional studies. Cross-sectional studies are actually, again, it can be of either. So in this picture, it is fallen under analytical study because majorly we do it analytical study, but it can be also come under descriptive because cross-sectional studies are again divided into descriptive cross-sectional studies and analytical cross-sectional studies. So this is the classification of the research designs. And under the experimental, so you understand the first classification is only two. What are they? Experimental study designs and observational study designs. Then the observational study designs are further classified into analytical and descriptive based on the purpose. Based on the purpose, each of these study used or work, based on that it is again divided into descriptive and analytical. And you just I want you all to by heart this. Actually by heart Allah, it's not by heart, it have to be there in your mind always. The basic classification, that is experimental and observational. Then the observational is further divided into descriptive and analytical. Then under descriptive, we have case report and case series. Under analytical, we have cross-sectional, case control, and cohort study. Okay, so these are the types. Coming under the experimental, we have the important one, that is randomized control trials. And also, finally, we have, you can see the top of that, that is meta-analysis. We have seen in the first slide also. We have seen meta-analysis was the top-notch evidence for the study designs in clinical research. Okay, so you all keep this. And now the problem here with us is we have so many objectives. Now we don't know which one to be chosen. So that is the key points that we are going to study today or learn today. Now I would like to give an exercise. Please see this picture. There is something wrong in this. Could you please? We have seen the classification already. The first classification is the research designs are divided into two. One is experimental and the another is observational. Okay, experimental and observational. So under the observational, it comes to one is descriptive and another is analytical. But in this picture, we can see it is directly divided into descriptive, observational, and experimental. There is no such classification. Okay, so the study designs are basically divided into experimental and observational. Then under the observational, we have descriptive and analytical. Hope you all understood. So here they have written observational. Actually, above that, what have to come? Analytical study designs. And this cohort studies, case control studies, and cross-sectional studies are coming under analytical study designs. Case report and case series are correct, coming under descriptive. So where this observation should come? Observational should come above descriptive and analytical. So now let us know what is the basic difference between descriptive and analytical study designs. Yeah. So let us know what is the basic difference between descriptive and analytical study designs under observational studies. Okay. So descriptive studies, that will just describe the data. Okay. Describe the data, whereas analytical studies will find why this data come like this and what is the relationship between this data, how I can analyze this data. Okay, so analyze and come to an inference. Okay, analyzing the data and coming to a conclusion. So that is what is analytical research, whereas descriptive data, it just describe the what is our finding. So for example, I will give you an example. We want to make an association between obesity and hypertension. Okay, so everybody just imagine this scenario. Suppose in a village, there is 1 lakh people. And for that, out of that 1 lakh people, you are conducting a survey. And you found that out of this 1 lakh people, 20,000 people are obese. 20,000 people are obese. And where their BMI is above 30. And out of this 20,000 people, 15,000 people are diabetic. 15,000 people are diabetic. So this count is what? Descriptive study. Total population in the village is 1 lakh. Total population under obesity category is 20,000. Out of that 20,000 of obese people, people with the diabetes are 15,000. Then remaining 5,000 are obese but no diabetes. So this count we are just describing the population. This is called descriptive research. Whereas analytical research is, we are now trying to interpret the data. Why the 15,000 out of 20 obese are having diabetes? Whether is there any relationship between diabetes and obesity? And we are trying to prove it. So that is what is analytical studies. Okay, so descriptive study is just to describe the data, just to present the data, this many, example in terms of frequencies or means or variance. We are just presenting the data. This is what is our finding. Okay, so just the findings, there is no interpretation, there is no inference. Okay, so that is what is called descriptive research designs. Or whereas the analytical research design, you can see that downside, that green color, 4 points are there. So the analytical study designs, what it do means, it will examine the existing data. What is the existing data? Out of 1 lakh, 20 people are obese. Out of the 15,000 are diabetes. Then we identify some pattern of relationship. Is there a relationship between obesity and hypertension? Okay, and we try to understand such a complex phenomenon by testing hypothesis or by applying statistics. We try to resolve it or we try to answer it. So this is what is called analytical study designs. Hope you all understood what is the major difference between descriptive research and analytical research. Some people always confuse that the analytical research and inferential statistics is almost the same. No, there is a great difference. Inferential statistics means a sample population is used. See, in the scenario I have told, there are 1 lakh people in a village. Do you think it is easy to go and interview 1 lakh people? No. So instead of that, out of 1 lakh people, I am taking a 10,000 people. I am conducting a survey on 10,000 people, and I understood out of that 10,000, 2,000 people are obese, and out of that 2,000, 1,500 are diabetes. The same findings of what we done in the 1 lakh people, we can get by studying 10,000 people, because this 10,000 people represents the entire population. This 10,000 people represents the entire population. Okay, so this is what is called inferential statistics, which means we study a sample of group and they represent the entire group. So this is what is called inferential statistics. Okay, so hope you all understood what is the difference between descriptive and analytical study designs. So again, I want you all to clear that the basic classification is, it is divided into, mainly the research design is divided into two. One is experimental study and observational study. Experiment studies are again divided into randomized control trials and non-randomized control trials. Observational studies are again divided into descriptive studies and analytical study. We have already understood what is the difference between descriptive and analytical. Under descriptive, we have two. One is case report and another is case series. And under analytical, we have cross-sectional, case control, and cohort study. So now we are going. So hope you understood what is the basic types or classification of the research designs. Now we go on to one by one. Okay, what is case report, when it is used, what is its advantage, disadvantage, what is case series, what is cohort, what is case control, what is cross sectional, everything we will understand now one by one. So in this slide, I take your attention towards this left-hand side corner. I have kept two pictures. One is case report and another is case series. So that itself say, what is case report? It is about one patient experience. Okay, it is about one patient experience, and we make a record of the experiences of one patient or the events of the one patient. That is called a case report. Thereafter, we are collecting the series or n number of similar cases or n number of similar cases with a similar exposure and a similar outcome. Okay, the same exposure and the same outcome. Suppose one of the adverse drug reaction we have seen in our hospital recently is a phenytoin induced Steven-Johnson syndrome. So it happened in one patient that phenytoin caused Steven-Johnson syndrome. So after that, what happened? To whomever the patients we prescribe phenytoin, we will monitor that patient very closely, whether is there any symptoms of Steven-Johnson syndrome is exhibiting or not. Okay, so this is what is case series. So case report is the description of the experiences, or it is a report of the experiences or events of a single patient. That is called a case report, where we collect a n number of cases of the same exposure and outcome. That is called a case series. So you can see the difference between case. See what I have told. One patient we given with the phenytoin and the patient experienced Steven-Johnson syndrome. So this is absolutely a signal generation or a hypothesis generation. So you understand, case report is always act for generation of the hypothesis. Oh, whether phenytoin will cause Steven-Johnson syndrome? Will it cause to everybody, or will it cause only in a specific age group, or will it cause only in a specific conditioned people? It generated a hypothesis whether phenytoin will cause Steven Johnson says. So you understand, case report is always a signal generation or a hypothesis generation, whereas case series is used to prove the hypothesis. Actually, we can I won't say prove also. It just strengthen the hypothesis. It will just strengthen the hypothesis. So, which means being a clinical pharmacist, I have noticed after giving phenytoin, one patient have experienced a Steven Johnson syndrome. I go and report it to the neurologist. Excuse me, sir. One of your patient you have prescribed with the phenytoin, he have experienced Steven Johnson syndrome. Immediately the physician will object. No, 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 I have been given this for me. So we have only one patient. It is just a weakest form of evidence. Okay. So phenytoin is just a weakest form of evidence, and it just generate a hypothesis, it just generate a signal. Whereas if I go again and speaking to the same neurologist, sir, 10 of your patient I have noticed you have given phenytoin, and the 10 of them have the symptoms of Steven Johnson syndrome. So that is a case series. It is a strong evidence. Now the physician cannot object it. Okay. So this is what the difference between case report and case series. Because in the case of case report, there is multiple chance. It may occur by chance. It may be occur by any other reason. It's not only because of phenytoin. It may happen because of so that probability is there. Probability. So we say in statistics the probability of occur by chance. Okay, that is very high in the case. That's why case report is a weak evidence, whereas case series is a comparatively strong evidence. Okay, and case report generate the hypothesis, but a case series will strengthen the hypothesis, and greater the number of case series, more the evidence will be. But case report, how we can prove? We have to go for any lab reports or lab test. Sir, phenytoin level decreases, we have to go for therapeutic drug monitoring, and we have to prove the concentration of phenytoin decreases, Steven Johnson syndrome decreases. The concentration of phenytoin increases, the Steven Johnson symptoms also increases. Okay, so the case report can be proven by laboratory evidences, whereas case series is by number of cases. Okay, so what happens here, being a clinical pharmacist, what I did, one patient got a Steven Johnson syndrome after phenytoin. What I do, you can see in that picture what that doctor is doing with the lens. She is going and searching who is having similar exposure. Exposure here is the phenytoin, the drug. Okay, and the outcome is Steven Johnson syndrome. So she have an n number of patients in the hospital or in the neurology department with epilepsy, and they have given phenytoin. So she is now going and picking up. So you can see here there is a big population. Out of that big population, epilepsy happened. That is that brain something disease, blue color I have given. Okay, that patients we are going and search. Okay, are you an epileptic patient? Yes. Then again we are searching, are you given with the phenytoin? Yes. Then we are again checking whether you got Steven Johnson syndrome or not. Okay, so like that we are picking up. That is how a case series will be generated. So hope you understood what is the use and purpose of case report. If we have only one case and we have a detailed description of that one case, but no any other further details or no n number of cases, then we go for case report. If we have n number of cases with a similar exposure and outcome, then we have to go for case series. Hope you all understood what is the basic difference or the purpose of case report and case series. So now next we move on to the next study design. Okay, so what is the next study design? We have told is cross-sectional studies. Okay, so cross-sectional, I would like to know this concept from that word cross-section itself. I take you all to your pharmacognosy lab. In a pharmacognosy lab, to see the structure of a stem, what we do, we take a cross-section and we look under the microscope. So that gives how that entire stem looks like, or the cinnamon bark. We take a cross section of the cinnamon bark and we observe it under microscope to know how that entire bark look like. Okay, so just one session, one section is enough to know the entire section, entire population. So here also, suppose you made a cake, you want to taste it, whether you will eat the entire cake or one piece is enough to know the taste of the entire cake. So like that only here we do. We have a population. We need, so whatever the examples I have told already, obesity and hypertension. I have a village of 1 lakh people, but I cannot go and study all the 1 lakh. So what I did, I pick up a 10,000 people out of the 1 lakh randomly. Randomly, I pick up a 10,000 people. Then I observe that 10,000 people who represents the 1 lakh people in the village. So this is what is a cross-sectional study. So in a cross-sectional study, we take a section of the population that represents the entire population. Okay, so you can see there is a target population, that is a big round, that's a big village. Out of that, we are going for a study sample. We take a few people, that is out of the 1 lakh people, I took a 10,000 people. Then I gather the data. What data I am gathering? Exposed and outcome present, which means obese and diabetes. How many? How many are there obese and total 1 lakh people? In that I have 10,000 people I have taken. Then I am saying in that 10,000 people exposed and outcome present. In that 10,000 people, 2,000 people are with the exposed, which means obese. And out of that, 1,500 are with the diabetes. That is exposed and outcome present is 1,500. Next is exposed and no outcome, which means obese but no diabetes. Remaining 500 people. Out of the 2,000 obese people, 1,500 are having diabetes, but another 500 are obese but there is no diabetes. That is what exposed and no outcome. So here we collecting the data and categorizing the data. The next we are saying is unexposed and outcome present, which means how many are non-diabetic, non-obese and non-diabetic. Then among non-obese also some diabetics will be there. So that is what we study in a population. You can see here this right hand side picture. So what you can see, the time is going towards the one direction and we collect data at one point of time. Okay, so you always understand cross-sectional study means it is just a survey. Today I am conducting a survey at one point of time. There is no follow-up. There is no follow-up like after 2 months again I do, again after 2 months I will do, again after 2 months. Like that, if need we can design, but basically that is also their multi-phase cross-sectional study. Okay, multi means that is I am speaking about what is cross-sectional study, which means the data collected at one point of time. If you want to repeat it at the multiple phase, you can go for multi-phase. Okay. But absolutely what is cross-sectional study means we are just conducting a survey at one point of time. And you can see the downside I have written. It is also known as instantaneous study, simultaneous study, prevalence study, snapshot study. You can see that one camera picture. Because today I go and click a picture of that population. I got a clear picture. There are 1 lakh patients. In that 20,000 are obese, in that 20,000 15 are diabetic, and another 5,000 are non-diabetic, or totally 1 lakh. In that I took 8,000, 10,000 people, in that 2,000 are obese, in that 1,500 are diabetic, 500 are non-diabetic. I came to a conclusion. I got a clear picture of that village people and association between obesity and diabetes. Okay, so this is why it is called a snapshot. Snapshot means what? A picture, a screenshot, a capturing. Okay, so I got a complete picture of that population today. Today itself I got. That's why I call it as instantaneous study. Because today I got the result. There is no follow-up, there is no waiting, there is no anything. Today itself I got a picture. So that is why it's called instantaneous study. And also it is called simultaneous study because morning I collected the data, Evening, I interpret the data. Today itself, I got the results also. The interpretation of the results also done. That's why it is called a simultaneous study. And it is also called a prevalence study. Because why? What is meant by prevalence? Prevalence means old and new cases. So today I went to the village and I check how many are having diabetes. They may be newly diagnosed diabetes, or they may be having diabetes since 10 years or since 5 years or since 20 years diabetic, or just 2 months, or somebody say last week I had, so the last week or yesterday I checked it was high. So there may be newly diagnosed people as well as already diagnosed people. So that's why it is a prevalence study. The cross-sectional study will give a complete picture of the population. Okay, so that is what is cross-sectional study. So you understood case report, case series. These two are descriptive study designs. Then now we have finished the cross-sectional study designs. Cross-sectional study design can be descriptive or it can be analytic. Okay, so now we are, so this cross-sectional study is a transition between descriptive to analytic. Okay, so now we move on to the analytic study designs. So in analytic study designs, we have cohort study and a case control study. Okay, and cross-sectional study. So cross-sectional study we finished already. So now let's move on to cohort study and case control study. So these two studies are almost similar. So first of all, I want to say what is meant by cohort. What is meant by cohort? So the meaning of cohort means it is a Roman, what to say, army people. Okay. So it just means that group of people having same experience, or group of people with the, so you can see at that downside picture, an army people, they all have the same uniform, they all have having the same gun, they are all trained to use the same, they all have the same experience. Almost all of them will be from, all of them are of course maybe Indians if it is in Indian army. And all of them, you see, they raise the hand properly, they raise the leg at the same time, they are all trained by same time, they all live in the same place, the experience of the people is same. For example, in this meeting right now, all the delegates, we all are clinical pharmacy background, either PharmDs or M.Pharm pharmacy practice. We are all the pharma background or clinical pharmacist background. So this is a cohort. This is a group of, this is a cohort of clinical pharmacist. Okay, so cohort means a group of people having same experience or same exposure or same. So all the people born in a same year, that is a birth cohort. All the people work in a same, that is an occupational cohort. So like that we have cohort. So here in a cohort study, what we do, no, so in the cross-sectional study I have told you already that there is a old cases as well as new cases. Some may be newly diagnosed, some may be already diagnosed, some may be having diabetes since many years, like that, like that. But coming to cohort study, what happen is we take all the healthy volunteers. So you can see here in this left hand side picture, you can see 2018, then there is a 10-year gap, then 2028. What you see the difference there? In 2018, 1, 2, 3, 4, 5, 6, all these 8 peoples are healthy, they don't have lung cancer. But by 2028, 1, 2, 3, 4, 5, 6 people are having lung cancer. Okay, so what we are doing here in cohort study, what we are doing means I took 100 people, I took 100 healthy people. That is the most important thing that differentiate cohort study and case control study. In cohort study, we are taking healthy people, whereas in case control study, case means what? Is a patient. Case means a patient. So in a case control study, we are taking patients, whereas in a cohort study, we are taking healthy samples. Okay, so you understand, in 2018 I took 100 healthy people, I divided them into two group, 50-50. To 50 people I gave nicotine cigarette, which can cause lung cancer. Whereas to the another 50 patients, to not patients, to the another 50 subjects, because they are healthy right now, they are not patients. Okay, so to the another 50, I give menthol cigarettes, which will not cause cancer. Okay, so then I am following year by year. 2018 become 19, 20, 21, 22, 25, 26, 27, 28. By 28, I see all the patients, or major out of 50, 45 of the nicotine taken patient got lung cancer. Only 1 out of menthol cancer got lung cancer. That is maybe due to his genetics or his family history, or maybe he have any another exposure like that. One maybe it can also happen due to other reasons. Okay, but 45 of the 50 nicotine smokers got lung cancer after 10 years. So I hereby I make an association between exposure and outcome. What is the exposure here? Smoking. What is the outcome here? Lung cancer. So I prove the association between exposure and the outcome between the smoking and lung cancer. So you understood what is the purpose of cohort study. We may, if you want to make an association between an exposure and outcome, then we have to go for cohort study. So cohort study is costly because I have to take 100 people. I have to follow them for 10 years, and once they go to lung cancer or something, in this case I'm saying I have to give compensations for them. I have to follow them for long. So it's a costly study. It involves follow up and it takes so much time. And what happens here? Here we study the incidence. Here we study the incidence in cross-sectional. In the survey, I went to the village. Are you diabetic? Yes. How many years? 10 year, 20 year, 15 year, 3 year, 3 months, 3 days. I involved old and new everybody. But here, when I start the study, all are healthy. See, you see the 2018 group, single person also not having lung cancer. All are healthy. And during my study, they got lung cancer. Okay, so that's why we say cohort studies study the incidence of the people and it involve multiple follow-up. Understood? Whereas cross-sectional studies study the prevalence, old and new. Okay, so hope you understood. And it is like a forward study. Cohort study is always a longitudinal study or a prospective study or a forward study or a longitudinal study. Means present. Today I enrolled, then I started following present to the future. So cohort study is majorly prospective, but there are retrospective cohort studies also and ambi-cohort. We call that is prospective and retrospective mix also. Okay. So, but majorly if we say it is prospective study or a longitudinal study. So hope you understood what is cohort study. If the cohort study is well and good you understood, then it is very easy to understand the case control study. So coming to the case control study, here also we have two groups. So in cohort study, we have two groups. One is nicotine cigarette, one is menthol cigarette. That is, one is exposed, another is unexposed. Whereas coming to the case control study, here also we have two groups. That is, one is cases and another is controls. So cases means what? Diseased people. Okay, so cases are the diseased people. So suppose myself, Dr. Robin. Robin got a lung cancer. The same scenario we take. Robin got a lung cancer. See, nobody is following me from past 10 years. Nobody is following me. Presently, I got lung cancer. The doctor is said to my parents or to my relatives, Robin is on lung cancer stage 3. So the relatives are asked or the bystanders asked why he might have got lung cancer. Then we look back. The doctor will start asking question whether in your family anybody is having lung cancer, whether his grandparents anybody was having any cancer, in your family anybody have a history of lung cancer or any other cancer, whether he was a smoker, whether he work under asbestos. What is Robin's brother? Okay, I have one brother, Roy. Okay, so you imagine Robin and Roy, they both are having almost same genetics. They both are from the same parents. They both grown up in the same scenario. They both studied in the same school. They both had the same food which the mother gave. They both developed in the same way. What makes a difference? Robin was a smoker, but the Roy was a non-smoker. So this is what is case means after the disease have occurred. So the event have been occurred here already. Now we look back why it happened. So, but in cohort study it was healthy people taken, we made them expose and continue. Whereas in case control study, already event have been occurred already. Now we are comparing back or questioning back or studying back why he got the disease. That is called case control study. So it is an event to exposure. The cohort study was exposure to event or exposure to outcome. Smoking to lung cancer. But this is now lung cancer already diagnosed. Now we are looking back why he got lung cancer. Okay, so that is the major difference. And in case control study, we take simply randomly 100 healthy people. But in cohort study, we randomly take 100 healthy people, we randomly divided them into 50-50. But in case of case control, we cannot go for randomly select the control. See, Robin is compared with Robin's brother, who is having a 80 percentage or 90 percentage similarity to Robin. So here one step is involved, that is called matching. The control we selected should be a matching one, not a random one. Random ones we cannot compare with the case. Whereas in cohort study, we randomly choose the subject, we randomly divided and we compared. Whereas in case control study, selection of the cases, selection of the control, then matching of the case and the control. Okay. Matching of the case and the control. So hope you understood the basic differences between what is case control, what is cohort, and what is cross-sectional, and what is case report and case series. Have you understood? I guess yes. And so by that, what finished? No, the observational study designs finished. So we can see at that first picture. So we can see here the observational studies are divided into descriptive. Under the descriptive, we have case report and a case series. Again, we have observational study divided into analytical. Under analytical, we have cross-sectional, case control, and cohort. So all these 1, 2, 3, 4, 5 has been finished. Okay, case report, case series, cross-sectional, case control, and cohort. Okay, have been finished. So now what we have to do? We have to study about the experimental study design, that is randomized control trials and meta-analysis. So are you ready to move to the next phase? So this is what is the randomized control trials. Okay, so what is randomized control trial? A group of people we are taking and we are randomizing into two. See, the randomization, it is not just a divide into two group. See, in a case control study, we have a second group to compare, but that is a matching group we selected accordingly. I would like to take your attention towards this right hand side top picture under that FCPA logo. You can see there is a study participants of all the color purple, green, blue, orange, light blue, everything. And they are divided into two group. One is control group and the another is interventional group, okay, or the treatment group. Control group and the treatment group we have divided. Who divided? Whether it is divided by any human, what you can see there in the middle, it was a computer. Okay, it was a laptop or it's a computer, or we can simply say it's a randomization software. Okay, so here in a randomized control trial, these trials are used to test a hypothesis or to study the efficacy of a drug or to study the valid relationship between two variables. Okay, so what I have to specify here is you can see the study participants are divided into two groups by the computer. Okay, so how it happen means like all will be what to say labeled as A B C D A B C D A B C D. Then we say A and D come to one group B and C come to one group, or like 1 2 3 4 1 2 3 4, and all the odd numbers come one side even. So randomly we are dividing the patients into two groups, because this is done to avoid the bias. Okay, avoid the bias. Why the bias means, otherwise what happen, I want to conduct some study and I want to prove my drug is very effective. What I do, I select only stage 1 cancer people in one group, and stage 2, 3 and or in the control group. And I will say the stage 1 people, they are treated by my patient, all my patients, all my drug treated patients were cured. Actually, it happened because they are just a stage 1. That's why. So there is a chance of bias. To avoid this bias, we have to categorize the patients into randomly. Okay, so this is called randomized control trial. So what we are saying is, this randomized assigning or the randomization ensure that all the observations between two groups, it is not by other factors. Okay, like they were only stage 1, that's why it is skewed, or like that some other factor involvement will not come. Okay, so that is what we divide the entire population into two group. One is control group and a treatment group. So that treatment group will give your drug, what is your invented drug, whereas the control group will take the either placebo or any other existing standard treatment. Okay, so this is what is randomized control trials. Okay, again these randomized control trials are, again there are divided into different models. Okay, so in a clinical trial we can see here that is called a crossover study and parallel study. First you see what is parallel study, the same thing as we have mentioned already. So what is parallel study means, we have a two group of people, we divided them into, we have a lot of subjects, then we do randomization about the A B. Then we have a sequence, all A's to one group, B's to one group. To one group I give the tested drug, to the other group I give the control or the standard drug or the placebo. Okay, so that is what is parallel study. Now, coming to what is crossover study. So crossover study means it is a two-phase study. Okay. So what happens here means, we gave first a medication A to the group or the test drug. Then after some time what we'll do means, once that is study, we give the control drug to the test people and test drug to the control people after a washout period. So what is meant by washout period means that drug T half, the complete elimination of the drug from the body, how much time, based on that we set the washout period. So the same people who already received the test drug, they will take the control drug now or the placebo now, or previously those who have taken placebo, now they will take the test drug. Okay, so this is what is crossover, but between this crossover we will maintain a washout period. Okay, so this is another type of randomized control trial or a study design. And also you can see here factorial design of trial. So this is based on some factors. For example, just now was, stage 1 cancer patients, one. Stage 2 people, one. This is also called a cluster group. Okay, because we see sometimes multi-center study. So for example, suppose if we say HCG hospitals. Okay, so they are conducting some study about some transplant rejection or something, or this bone marrow transplant rejection, or they will have their sites at Bangalore one, Pune one, Jaipur one, Chennai one. So like that, multi-centered study. So those will come under cluster group. Okay. And also maybe only stage 1 cancer, they will, so that is called a factorial. Based on some factor, we randomize. Okay. So that is what is randomized control trial. So hope you understood what is randomized control trial. Also, if there is no randomization, this computer is sitting and dividing them into two group now. If there is no randomization, then it is called non-randomized control trials. Okay, and now let us know what is meta-analysis. Last 5 minutes. What is meta-analysis? So the meta-analysis, we have told that it stand at the topmost evidence, or it's there at the pinnacle of the pyramid. Okay, so what happens here in the meta-analysis? We are not conducting a research, but we are statistically and quantitatively evaluating the previously conducted researches on the same title which are independently conducted. Okay, so for imagine I want to prove that the same phenytoin will cause Steven-Johnson syndrome. So regarding that, some study conducted in China, some study conducted in Europe, some study in India, some study in Korea, some study in Pakistan. Okay, so independently they have conducted, but all the studies are related to epilepsy, phenytoin, and Steven-Johnson syndrome. Okay, so what I do, but there is no any exact conclusion. Somebody is saying yes, it will cause. Somebody is saying no, it won't cause. Some studies are saying only for the doses more than this it will cause Steven-Johnson syndrome. Somebody saying already people having any skin related issues, then only. So there is no exact conclusion regarding this matter. So in such cases, what we do, we compile the results of these independently conducted studies and we come to a conclusion. So that's why it serves as a what to say, strongest evidence. Okay, and you can say it moves beyond the limitation, because the China conducted study may be conducted only on less number of population, or the study conducted in India, they might have conducted only on absence seizure, or the other one study in USA they conducted only on pediatrics. So in all those cases, all studies have one drawback. So we summarize the results of everything and we come to a strong evidence or a strong conclusion, that is called a meta-analysis. Okay, so this is nothing we are doing. There is no need of model. The entire concept is different, collecting the data from the databases and we are evaluating it statistically using some forest plot and a funnel plot like that. Okay. So that is what is meta-analysis. So you are very clear about the study designs now. What is experimental study designs? What is randomized control trial? What is non-randomized control trial? What is analytical, descriptive, everything. Now let's do this. Okay. So this is the last 3 minutes I take. So here what we have to do is how to choose. So here you see that downside box, 3 questions I have given. Is the purpose of the study is to describe. If we just want to describe, then we have to go for, see, you answer this question. So whenever you are in a situation to choose a study design, you have to self question yourself. Is the any measurements we have made and measurements we are comparing statistically and all? No. Then what we are doing? I just have a description of the data. I just have a description of the case. Then it should be a case study or a case report or case series. The next question, whether I am following the patient 1, 2, 3, 4. No, I am doing it only at one point of time. I am going to the village on one day and conducting a survey only once. There is no follow-up. Then I have to go for a cross-sectional study. Okay, so this is what is the descriptive studies. Okay, then coming to the analytical study. So here comes whether I want to make association between, I have to make a relationship between two variables, smoking and lung cancer. Okay, so here again come to the question. You ask yourself whether the data are collected from the participant more than once. Yes, its follow-up is there. Yes, then the same participants are followed entire study. Yes, in the case Robin got lung cancer, I can follow only Robin. No, I cannot follow any other person. So the same Robin is followed. Yes. Then the comparison group is based on outcome. Comparison group means what? My brother. Outcome is what? Lung cancer. So Robin got lung cancer. So I select a comparison group, that is Robin's brother, which means it is a case and a matching control. So it is a case control study. Then again, ask your question, the same things, whether the participants are followed more than once. Yes. Then participants are followed entire study. Yes. Then here we are saying where comparison group designed based on outcome. Here means Robin got lung cancer, so Robin's brother is chosen. But here in cohort study, no, I randomly collected 100 people and divided them into 50-50. So no, where the comparison group is not defined based on an outcome. No. Then we are again asking the participants are followed throughout the time. Follow up, follow up, follow up, follow up. Yes, because 2018 to 28 we follow up. Then it is a prospective. cohort study. Okay, so to make an association between two variables, you have to go for case control and the cohort studies. Okay. Then the purpose of the study is to determine the effect of an intervention. I want to say my drug is effective or my policy is effective. Then we have to go for randomized control studies. Okay. So you see here a random, if the comparison group is used, yes. Whether randomization, any system is used to randomize the people or computer based, yes. And the people are assigned to groups, yes. Then it is a randomized. Okay, so next you see cluster randomized, which means not the individuals, where the individuals are not randomized, whereas the groups or the sites, I told no, HCG have different sites. Okay, so different sites or different groups are randomized, then it is a cluster randomized. And if there is no randomization, then it is called a non-randomized study. And this we have seen already, that is, if a comparison group is used, yes. Whether the assignments are randomized, no randomization is done. But what happened, first I received a placebo. After a washout period, I take now the test drug. So that is called a non-randomized study, but it is a crossover trial. Okay. So this, hope you all are clear by practicing this. So I want to say that whenever you come to a position of selecting a study design in your academic life or your research life, always ask these questions: what I want to do, association of, or I want to test the efficacy, or I have a how many group, a group, whether same group I am using, or I have already diseased people or healthy people. So based on all this, we can select the study design. So by this, I come to a conclusion of today's session. So hope you are clear with all these, that what are the types of clinical trials and all. And I thank FCPI for giving me this opportunity. And also I hope all the delegates, this little insights may help you in your near future of your research life. Thank you. For any other further queries or contact, you can, I have mentioned my mail ID and mobile number. Please feel free to contact. Thank you.
Thank you so much, Dr. Robin. Actually, it was an insightful session where you have described all the uh, things about the different types of study designs, like clinical trials, from starting from the base case report till the clinical trials and meta-analysis. You have explained it clearly. So I'm sure that our participants would have understood clearly. I just wanted to ask you a small doubt in this.
Yeah. Yeah,
When
please.
when we are going for clinical trials, we hear a term called as blinding. How
Ah,
important is blinding
yeah,
really?
how the blinding works. Okay, so blinding. See, I told no, it's all here in this picture I have shown in the middle. There is a system. Okay, so that software will, because see, I have two groups. You imagine one group is receiving my drug, which I am saying I invented. The other group is receiving the placebo. And what will be the researcher's intervention or in intention already? I want to prove my drug is effective. So always there is a soft corners towards the patients who receiving my drug compared to the those who taking the placebo. So there is a chance that a doctor or a researchers can manipulate the study outcomes based on his intention. So to avoid that, we do blinding. Blinding is again divided into single blinded, double blinded, triple blinded, like that. Suppose single blinded means we have 100 people. Suppose for cohort I have told, I took 100 people divided into 50-50. To somebody I give nicotine cigarette, somebody I give menthol cigarette, but the participants don't know I am smoking nicotine or I am smoking menthol. That is a single blinded, which the participants don't know. Sometimes it's called double blinded, which means the researcher also don't know. There is a third person. That is also one role of clinical pharmacist or the clinical researchers, because you will take the role of blinding. The researcher also don't know who is taking my drug and who is taking the placebo, or the researcher don't know who is smoking menthol cigarette, who is taking actual nicotine cigarette. So it gives more accuracy without any bias. So this is called blinding. It can be done with the help of a third person or with the help of softwares.
Yes, thank you so much, Dr. Robin, for
Thank
taking
you.
your time out of your busy schedule for us. Thank you to FCPI team for organizing this basic module. Thank you everyone for participating. Thank you.
Thank you so much.